Good afternoon. Welcome to day 336 at the EMA office, where we're going to bring you the latest on the COVID fight and the vaccinations and the numbers and a little bit of everything. Chairman, I think before we get started, we need to talk just briefly about the vaccination site, some issues there, people from other states signing up. And as we said every day now, if we had a surplus of vaccine, that would be no problem, but it's really created a problem today.
So, we had hoped to be regional and to let things open up, but unfortunately with Illinois gets its vaccine based upon the population of Illinois. St. Clair County gets its vaccine based upon the population of St. Clair County. And what we were finding is that 80% of the appointments that were set up were from people who were out of state. Someone figured out how to get through the system and make it hard for people who legitimately need the vaccine who live here to sign up, and it created a clog. And so what happens is when you have 800 people signed up that don't meet the qualifications, they're underage, they're whatever, and they're from Missouri, when you get rid of all those appointments, now you have to fill those appointments for that day, or you're going to have too few people running through that day. Doesn't mean that vaccine goes to waste,
No.
But what it means is the manpower that's there, all the people that are there ready to give shots, they don't have the people to give those shots to. So what we're asking is that the people who live in the St. Clair County zip code sign up. 65 and older are those that are being vaccinated right now. Let's follow the rules and we'll get through this. Once we get enough vaccine for everyone, we're glad to vaccinate everyone from everywhere. But we've got appointments, people driving here from Indiana.
Yeah, family. A 12-year-old, it's not even eligible at this point in time.
The appointments from California and Wisconsin and Michigan, and all of those are taking up appointments from people that are in Illinois that are getting vaccine based upon Illinois allocations. And so we're trying to make this work. We're doing this mass vaccination, and it was working well until someone or a group of people really hurt the system by trying to cheat and get around the rules as they exist.
And the information that was sent out clearly states on there that if this is not intended for your use, you're not supposed to fill it out, but some people did that and then they shared it out there. So, and that's why people who have showed up today was turned away because they weren't over 65 years of age, or they weren't in one of the categories that we are working on now. So we just wanted to clear that up right now.
And we understand that there is an issue with vaccine in Missouri. We've seen it all over the news. It's a big controversy that for whatever reason, the St. Louis area is not getting the dosages that they need. But we're here operating in St. Clair County. We've set up this center so we can vaccinate those who are 65 and older, and we need to be able to have the amount of vaccine we need then to get to our teachers, to make sure our teachers get vaccinated. The plan's in place, and then here we sit with a schedule that's filled up with people who don't qualify for the vaccine, and it makes it doubly difficult to get through this. But if you show up and you don't qualify for the vaccine, you will be turned away. That's the statement that needs to get out there. We are checking IDs. We're checking to make sure people qualify for the vaccine. So please don't sign up if you aren't in the 1B category that qualifies for the vaccination. And that right now is people who are 65 years and older.
Very good. Brian, you've got the numbers today.
I do. So for St. Clair County totals, we've tested 271,084. That is an increase of 2,081 since yesterday. For positive test results, we're at 27,122. That's an increase of 91 since yesterday, and those are males and females under 10 to their 90s. That brings our daily county positivity rate to 4.4%. For negative test results, we're at 243,962. Unfortunately, we are announcing a new COVID-19 related death in St. Clair County today, bringing our total to 427. And that was a female in her 50s with unknown health conditions. And our sympathies go out to her family. For those that have completed their IDPH required 10-day isolation period, we are at 25,773. For state totals, we have tested 17,021,919. For positive test results, they've received 1,158,431, which is an increase of 2,598 since yesterday. Unfortunately, the state is also announcing 32 additional COVID-related deaths, bringing the state total to 19,873. For hospitalization numbers, those are those hospitalized in St. Clair County. We have 62 patients in St. Clair County hospitals admitted due to COVID-related illness, and 5 of those patients are on ventilators. Regionally, we have 104 patients admitted due to COVID-related illness, and 7 of those patients are on ventilators. For our congregate living facilities, we will only announce those that have had changes. And today we have Caseyville Nursing and Rehab is at 164 cases and 12 deaths, which is an increase of 1 case. Cedar Trails of Freeburg is at 40 cases and 3 deaths, which is an increase of 2 cases. And the St. Paul's Home is at 173 cases and 28 deaths, and that's an increase of 3 cases. Before I turn it over to Chairman Kern, I want to talk about some generous donations that were received today at the fairgrounds for the men and women of the National Guard and the nurses and the health department staff that are working in these bitterly cold temperatures to make sure that those that qualify are receiving that vaccine. It started this morning, as many saw. Chairman Kern took part in the Rise and Shine at Hardee's and was able to bring a large quantity of breakfast sandwiches over for the National Guard. This afternoon, lunch was provided by the Empire Comfort Systems here in Belleville, provided a nice meal for everyone that was working. And this afternoon, the members of VFW Post 5691 in Collinsville stopped by with a truck full of drinks and packaged snacks and cookies and crackers to help make sure everyone stays fed, gets that snack on those breaks when they're in from those bitterly cold temperatures. So we thank all of those businesses, organizations, and individuals that are really supporting this effort here in St. Clair County, and understand that those individuals are doing a great service to all of us by being out there to make this all happen. So with that, Chairman Kern, I'll turn it over to you.
Great, thank you, Brian. We'll move into the zip code report. These are the COVID changes in these particular zip codes. So in 62059, we go down 1 COVID positive today to 36. 62201 is up 2 to 554. 62203 up 1 to 585. 62205 up 1 today to 611. 62206 up 1 to 1,229. 62207 up 1 to 556. 62208 up 5 to 1,514. 62220 up 3 to 1927. 62221 up 8 to 2603. 62223 up 7 to 1,623. 62225 up 1 to 132. 62226 up 11 to 2,988. 62232 up 4 to 842. 62243 up 4 to 710. 62254 up 2 to 764. 62255 up 1 to 76. 62257 up 2 to 327. 62258 up 2 to 973. 62260 up 2 to 751. 62264 up 2 to 342. 62269 up 5 to 3,064. 62282 up 2 to 63. And 62285 up 1 to 532. 91 new positives today. Out of 2,081 tested gives us a daily county positivity down to 4.4%. bringing our rolling average down to 6.8% today, all moving in the right direction. Regional positivity also is down to 5.6%. And that's because Bond County's coming in at 2.8%, Clinton County at 3.3%, Madison County at 5.7%, Monroe's also at 5.7%, Randolph 0.4% today, St. Clair County 1.7%, and Washington County is 12.2%. So Herb, I guess we're talking about the scheduling. If St. Louis or Missouri would like to send us vaccine and have us vaccinate for them, if they would provide the vaccine, maybe it might be a tenable situation to be able to do Missouri residents over here. We do have a great operation. We can handle a good number of people. So if there is vaccine in Missouri that they need to get out to their people, obviously there is, maybe we can talk about them sending their vaccine over here to us, and maybe we could help them with people who are signing up here from Missouri.
Well, and it's, we've said that all along. I mean, and we said it earlier, if we had that supply, we've got the demand for it. It's obvious, or people wouldn't be out there trying to sign up when they shouldn't be, and we would just say, come on, let's do it, and get the needles in the arms. But we've got to do it the right way. We've came 336 days. We went through all of this, and we're close. And right now, it's just everybody's got to have patience. And
they're getting the vaccine in Missouri. I mean, the state has to be getting their vaccine. I know they're 50th in the nation in getting the vaccine out. So if we can be of assistance, we certainly would be willing to talk about transferring vaccine to St. Clair County, and maybe we can do your residents for you in Missouri.
Yeah, we're willing to help do whatever we have to do because, like I said, we've proven the site that is set up has the capacity to take care of the demand. We just now need the vaccine, and we need people to be responsible, fill out the form on the portals, and be honest. And right now, we want to get the 65 and older in the category, and we will get everybody. We talked about the teachers. I know you and Mila has been talking about having a set schedule for that, working with the school superintendents.
As soon as we get through the 65 and older category, then we move into the teachers. And so, we can't do Missouri residents because we don't have the vaccine for them. We have Illinois vaccine. But as we said, if Missouri vaccine comes into the picture, maybe that is a possibility.
And we're surely not going to be doing out-of-state teachers before we do our own teachers.
And we understand a lot of the people that did sign up at our fairgrounds were teachers from Missouri that were looking to get vaccinated.
And we love the teachers. It's just that we've got to do it in a systematically way here, and we're trying to do that. The men and women down there at the site, they're trying to get people through there as quickly as possible. And then, as you said, every time somebody who hasn't followed the rules and has to be turned away, that slows that process down, and then it just puts a big wrench in it. So please, patience is what we need. We will get through this, and just say a little extra prayer that we get more vaccine in, and if we had that warehouse full of it, we would be able to take care of everybody, not have to turn anybody away. But right now, please be from St. Clair County, and we will get you taken care of as quickly as possible, and then we'll get through those other phases that we have to. We'll be back with Cindy in a few moments to translate this into our Spanish communities, and then we'll be back tomorrow with 337 days of the COVID fight. Thank you. Have a good evening.
I have battled this virus both professionally and personally. Professionally, I can tell you firsthand that it's greatly impacted our community, caused the loss of many lives, and continues to spread today. Personally, I can tell you that I contracted COVID-19, and it definitely is not the flu. This virus affects everyone differently, however, many have severe consequences. Please take this time to help your friends, your family, your neighbors, and the entire region by wearing a mask, washing your hands, and watching your distance. Together, we will overcome this invisible enemy.